Hello people, in this video we want to look at pyogenic meningitis. So what do you mean by pyogenic meningitis? See, there are a lot of type of meningitis, okay? In that here you can see that you have acute pyogenic meningitis. Pyogenic means pus producing. Pus will be there in CSF. That is, when you take the CSF, right, how it will be? It will be like this. It will be turbid. It will be cloudy. So this is what is shown. Normally how your CSF should be, it should be clear. Right? So it should be clear. But in this case, what will happen? The appearance of the CSF will be turbid. It will be purulent. There will be pus. Right? There will be pus cells. That means neutrophils will be there. We are looking at this row. Kindly pay attention here. So acute pyogenic meningitis, the CSF will be turbid. It will be purulent. There will be more pressure, right? Because so many cells, there will be more pressure here. What will you see here under the microscope? You will see a lot of neutrophils. And the proteins are more, the glucose is reduced, and in addition to the investigations, you can conduct a gram stain to know which bacteria, okay? So which are the bacteria which cause this acute pyogenic meningitis? You have the Listeria, you have the Neisseria meningitidis, very important to know. Neisseria meningitidis. Haemophilus influenzae is also a bacteria which causes what? Haemophilus influenzae causes meningitis. So Listeria, Neisseria, Haemophilus, Streptococcus pneumoniae. These four you should write in the exam. Listeria, Neisseria, Haemophilus influenzae and Streptococcus. These will cause your pyogenic meningitis. So how will you get the CSF? You'll have to do a lumbar puncture, right? So intervertebral, that is between L3 and L4, you'll have to do a lumbar puncture and get the CSF and analyze it. If you have gram-negative causae in pairs, what is it? Neisseria meningitidis. This you know, right? Diplococci. Okay, diplococci gram-negative, intracellular, Neisseria meningitidis. Don't forget, okay? Others like Streptococcus and all is gram-positive. Haemophilus influenza also is gram-negative, they are saying. Now that we are talking about the causes, remember guys, it is very important to know that 0 to 6 months Listeria and above 60 years Listeria. Listeria will be affecting only below 6 months or above 60 years. Listeria will affect only below 6 months or 60 years. This is very important to know. Okay. What about H influenza? Haemophilus influenza is between these two. 6 months to 6 years. Not 60 but 6 years. 6 months to 6 years is Haemophilus. Okay. Streptococcus is very, very nice bacteria. It will affect everybody. Streptococcus will affect all ages. So, whenever you are writing this age, you know, in the exam, they will ask you pyogenic meningitis. Okay, so how will you write? You write like this, okay? Put here 0 to 6 months. Then 6 months to 6 years. Okay. And then write 6 years to 60 years. And then greater than 60 years. Like this you write, okay? First of all, you know that Listeria will affect below 6 months and after 60 years. Then Haemophilus influenza will affect 6 months to 6 years. Streptococcus will affect everybody. Like this you write, okay? So you will get your table for pyogenic meningitis. Main we'll focus on these four only, okay? Because we know these are the four that cause. Which are the four? Listeria, Haemophilus influenzae, Streptococcus, and then one more we wanted to write. Which one? Neisseria meningitis. Or Neisseria you write in 6 months to 60 years, you have to write Neisseria. Right? Neisseria we forgot to write. Neisseria is there from 6 months to 6 years. Neisseria 6 months to 60 years. 60 years. 6 months to 60 years, Neisseria, don't forget, okay? So we'll focus only on four bacteria. Which one? Neisseria, meningitidis, Haemophilus, Listeria and Streptococcus. We'll focus on only these. Only these four we'll focus on. What do you say, people? One more thing they're saying is neonates E. coli. So E. coli can affect neonates. Okay. 0 to 2 months infant also E. coli can affect. E. coli, Klebsiella. Can you remember that E. coli and Klebsiella, neonate infant? Now let us look at the clinical manifestations. How will these children come? They have high grade fever, vomiting, intense headache, photophobia, intolerance to light. Neck rigidity, very important. They'll have neck rigidity because of meningeal irritation. Kernick signs and Brudzinski sign, very important. You focus on this Brudzinski sign, okay? Brudzinski. Okay, learn the spelling first. Brudzinski. Now, Brudzinski sign means what happens? This baby is sleeping like this, okay? What you do, you lift this neck, okay, you just put your hand on the chest or something and lift the neck, okay, like this. The child will automatically flex the knees and the hip, okay. So this is Brudzinski. What is this? Brudzinski's sign. Look at this. Severe neck stiffness causes the patient's hip and knees to flex when the neck is flexed. When the neck is flexed, the patient's hip and knees flex. This is Brudzinski. See, when you flex the neck, the knees and hip will flex. This is Brudzinski. This is video from our own channel. Look at it. So they're keeping the hand on the chest and flexing the neck. The child is flexing the hip and knee, okay. Kernick's sign is very easy. You will put the knee on the hand on the knee, okay. Just remember, when the hip is flexed to 90 degree, inability to straighten the leg when the hip is flexed to 90 degree. So you can think about Kernick's sign like this, hand on the knee, you're flexing the hip to 90 degree, right? It's inability to straighten the leg. Severe stiffness of the hamstring causes inability to straighten the leg when the hip is flexed to 90 degrees, okay? While we are looking at the clinical features, just focus here that the meningeal signs are lacking till 2 years of age. The meningeal signs till 2 years of age, you cannot get those, okay? And what and all will you see? Actually, lethargy, poor feeding, shrill cries, seizures, photophobia, bulging anterior fontanelle, headache. These are the things that you will look for. Meningeal signs only after 2 years child you can look for. If there's a purpuric rash, then it is meningococcemia. That is that cocci, Neisseria meningitis. Okay, be very careful about that. So these are the clinical features. If there is a rash, Neisseria meningitis also. If you leave as is, what will happen? There can be subdural effusion, empyema, ventriculitis, brain abscess, hydrocephalus, infarct, then so many other things. Syndrome of secretion of inappropriate secretion of antidiuretic hormone, deafness, epilepsy, intellectual disability, neurological deficits, hydrocephalus, all these can happen, okay? It can even be fatal, guys. So now pay attention to the treatment. First of all, let us talk about the prevention. Vaccination against Haemophilus, pneumococci, etc. Even for meningococci, it's there, they are saying. And even as a prophylaxis, you can give rifampicin, they are saying, against this meningococci, okay? Now let's talk about the treatment, guys. Treatment, they are talking about cephalosporin 3rd generation. Without any delay, you should give. So what are the 3rd generation cephalosporins? Cefotaxime, you should remember. Cefixime, cefotaxime, all these oximes you remember, zyme, okay. Vancomycin can be added, dexamethasone IV. This is a steroid, but they are saying that this you can give for preventing hearing loss and any short-term neurological sequelae you can prevent. So guys, just as a conclusion, how can you prevent meningitis? Vaccination. How will you prevent, right? So you will prevent with vaccination against Haemophilus influenzae B, meningococcus and pneumococcus. Then you can also avoid overcrowding. You can maintain hygiene. Nutrition of the baby should be good. That's why always food diet we keep telling for the child, right? Then breastfeeding will give antibodies many times. Then what else? Something else we wrote. Rifampicin can be given for meningococcal exposure if it is there, okay? Guys, look at this image here. This is a CT. Here you can see subdural effusion, bilateral subdural effusion. This is a child with bacterial meningitis. This one is bacterial meningitis. Okay. Now the next one is tuberculosis. Don't look at that. This one you look at subdural effusion. This is acute bacterial meningitis. Okay.